Hello, my name is Dr. John Lapkass. I'm a board-certified orthopedic surgeon at Anchorage Orthopedic Clinic, and I specialize in total joint reconstruction, arthroscopy, and sports medicine. In this video, I will be discussing anterior hip replacement. Anterior hip replacement surgery has changed the way surgeons perform hip replacements. This procedure requires the surgeon to access the joint from the front of the hip instead of from the side or rear. When performing anterior replacement surgery, muscles attached to the hip do not need to be cut. They are moved to the side. The anterior hip replacement approach is one of the least invasive surgical options in hip replacement surgeries. Factors that could lead a patient to have an anterior hip replacement are if their hip pain limits their everyday activities, their hip pain continues while resting at day or night, they experience stiffness, their hip limits their ability to move or lift their leg, anti-inflammatory drugs do not provide pain relief, and finally, if patients experience harmful or unpleasant side effects from other hip medications. An anterior hip replacement can actually be performed on anybody. However, a real consideration is patient size. The incision used for an anterior replacement is quite small, and if the leg is large, one is forced to work through a very deep hole. That can significantly complicate the procedure, and the size of the leg is something I take into strong consideration when considering somebody as a candidate for the surgery. Most people are just fine, but there are a few whose legs are so large that I would defer to using a standard posterior approach. After a patient has undergone anterior hip replacement surgery, the most evident benefits are dramatic pain relief, better range of motion, and an improvement of function. As an added benefit, the time from surgery to recovery is minimal. I have been involved in hip replacement surgery for nearly 30 years now. I've done hip replacements through posterior approaches, lateral approaches, and now, over the last few years, through an anterior approach. I have noted consistently that patients who have had their hips replaced through an anterior approach return to function sooner and have less pain at the early postoperative stages than patients who have had hip replacements through the other approaches I have used. To learn more about anterior hip replacement, please visit our website at afoc.com.